If inheritance questions feel confusing, it's usually because you're trying to memorize them instead of recognizing patterns. In this video, we're going to talk about modes of inheritance, but in the way that the boards actually test them. Boards don't ask you to recite inheritance charts. They give you families, patterns, probabilities, and then they ask you to interpret what you're seeing. The goal here is logic, not recall. So step one, what the boards are actually testing. Before we go through inheritance patterns, we're going to shift mindset a little bit to make these questions easier. Boards are asking who is affected, how many generations are affected, are males and females affected equally? If you answer these three questions, you can usually identify the inheritance pattern before you even look at the answer choices. Let's walk through the big ones. Autosomal recessive. Think early onset, very severe disease. Siblings are affected, but parents are usually unaffected carriers. The boards love autosomal recessive conditions because they present dramatically in childhood. Here's the classic pattern. Multiple affected siblings with parents who appear unaffected. That's autosomal recessive until proven otherwise. Board anchor diseases you should just know here. Cystic fibrosis, phenylketonuria or PKU, sickle cell disease, Tay-Sachs disease, maple syrup urine disease. These are not exhaustive lists, but they're anchors. These show up early, they're severe, and the parents are unaffected. Autosomal recessive is your default here. Now shift to a different picture for autosomal dominant. Autosomal dominant conditions show vertical transmission. That means that affected individuals are in multiple generations. One affected parent is usually enough. Boards also love testing variable expressivity here. So a parent may have mild disease, a child may have more severe disease. It's still going to fit into that autosomal dominant inheritance pattern. Board anchor diseases you should just know here: Marfan syndrome, neurofibromatosis type 1 or NF1, Huntington disease, familial hypercholesterolemia, and autosomal dominant polycystic kidney disease, or ADPKD. The key reminder is a variable expression does not break autosomal dominant inheritance. If the condition appears in every generation, this should be high on your list. X-linked recessive is one of the highest yield categories on the boards. Think males predominantly affected, females are usually carriers, there's no male-to-male transition. If an affected male has unaffected sons and all daughters are carriers, that pattern is X-linked recessive. Here are your board anchor diseases that you should just know: Duchenne's muscular dystrophy, hemophilia A and B, G6PD deficiency, Bruton's agammaglobulinemia, and Alport syndrome. Alport's actually a great example because one thing that you have to recognize here is an X-linked pattern, but another thing to remember which diseases live here. Clinically, Alport can have rare autosomal forms, but on boards, Alport is classically X-linked unless the board stem tells you otherwise. That's the level of nuance that boards expect. So putting it together for your board strategy, instead of asking what disease is this, ask who is affected, how many generations, what's the sex distribution. That logic is going to narrow your answer dramatically before you ever reach the disease name. Quick mental check. Affected siblings and parents unaffected, autosomal recessive. Affected individuals in every generation, autosomal dominant. Mostly males, no male-to-male transmission, X-linked recessive. Inheritance questions are not math problems, they're pattern recognition problems. What you might notice that we intentionally did not cover here: X-linked dominance inheritance and mitochondrial inheritance. Those are high yield, but they deserve their own focused videos. Separating them is going to keep this framework clean and prevent overload. For a final takeaway, you don't need to memorize every genetic disease. If you can recognize the inheritance pattern and remember a few anchor diseases, you will answer most of these questions correctly. This same pattern-based thinking shows up again and again in genetics. Boards reward pattern recognition, not memorization. See the pattern, choose the answer.